looks like we look great. Hello, I am Amanda Musgrave. This is my head-to-toe assessment for week 5 of the RN to BSN assessment course. This is my volunteer, Sue. Thank you for joining me again.
You're welcome.
To begin an assessment, I would do hand hygiene, introduce myself, and explain the purpose of my visit. We're doing a head-to-toe assessment today. I would also provide privacy for the patient. And I would begin by looking at the patient from kind of afar when I first come in, assessing hygiene. Does she dress appropriately? Does she look disheveled? I would assess her level of consciousness. Is she alert, drowsy, lethargic? I would also, as I speak to her and introduce myself, pay attention to her speech, her ability to articulate. Is it appropriate for her age? All these things I'm gathering as I introduce myself. I would begin at the top, just as it says, head-to-toe assessment. Inspecting her hair and scalp, I would use gloves for this part, but you could look for any pests, any area where there's hair loss, texture of the hair. I would also palpate the TMJ to see if there's any bumps, any soreness. I would also palpate the sinuses, the frontal sinus. Do you have any soreness?
No.
Good. I would also look at her face, her symmetry in her face. We're looking for one side being droopy. That is a sign of stroke or Bell's palsy. And also, I will touch one side of the face. Can you feel my hands on both sides?
Yes.
Okay. So she has sensation on both sides of her face. And we will move on to the eyes. I will inspect the eyes, looking at the sclera, conjunctiva, the pupils. Everything looks clear. I would also look for around the eyes, see if there's any tear ducts that are swollen in her eyelids. And I would begin, we have some tests to do. I would have to be right in front of you normally. And I would ask you to cover one of your eyes. This is the confrontation test. Tell me when you can see my finger.
I can see it.
Okay, can you put your other, switch hands?
Yes.
And tell me when you can see.
I can see it.
Okay. That's the confrontation test. There's also the 6 fields of view. We did this before, if you remember. Can you look at the tip of my finger? Follow my finger, but don't move your head. And I would watch to see if her eyes have any shaking. And she's doing a good job. It's called nystagmus when your eye shakes to the side. Looks great. Also, I would have you look at the wall, and now look at my finger that's close in front of you. Okay, good. I'm going to have you cover one of your eyes, and look at my finger. Now uncover your eye. It's called the cover test. We look to see if your eye needs to move or if it's in the right spot. You did good. Next, I would get my ophthalmoscope, which I don't have the one that I used before. It would have a light on it. So I'm just going to use this. It's an otoscope. I would go, if you look straight ahead again, I'd go about arm's length and shine a light in your eye. I'm looking for a reflection, and it looks good. I would, in a darkened room also, shine a light in your eye and see if it constricts. And then see if the other one constricts. And I would make note of the size of the pupil. Everything looked good there. I'd also, like I said, if this was an ophthalmoscope, I could adjust it out and then look into your eye. I could look through the eye to the, I can actually see some, to the, everything on the back of your eye, the retina, and you can see veins and even the little disc in the back. I would look on both sides. And then we can move on to the ears. I can inspect your ear from the outside first, noting any abnormalities, the way they're positioned. Then I would palpate. Do you have any soreness? Palpate the pinna and then the tragus.
No.
On both sides. No?
No.
Okay. The hearing test part. You probably remember this from our last one. I'm going to go behind your ear and say something, and you repeat the word for me.
All right.
Ice cream.
Ice cream.
Baseball.
Baseball.
Okay. Then we do get the otoscope and look into each ear. On an adult, we would pull back and up and inspect the canal. And we would be looking for the eardrum, looking for the light reflex, which I can see, and the malleus. That looks good. And there's no wax in your canal. No irritation on the canal. I know, it looks good.